causes things like in the gastrointestinal system, that is the eating system, the food system. It causes problems like dry mouth. You may find when you are chewing, your mouth dries up, and that one you can even find if you ask at random Mira chewers, they experience, dry mouth. That's why they take a lot of water. It's something that has also been caused by the Mira itself. You get gum problems, you get teeth problems because these teeth are chewed. So you get the gum is damaged, the teeth are damaged. Sometimes you get something we call gastritis or inflammation of the stomach where the food goes, because this juice is going on to land on the stomach, so it can cause inflammation. It can sometimes, rarely, but often, not rarely, it causes ileus, paralytic ileus, or intestinal obstruction. It can obstruct the intestines because it affects the nerves that are supposed to propel the food, so it stops functioning, and then it can cause blockage. It also causes problem in the liver. You can get liver fibrosis, liver cirrhosis. Sometimes it affects the bronchus in the breathing system, so you may not breathe well because of chewing Mira. It causes other things in the eyes. It can cause blurred vision. Blood vision in the eyes. It can cause dizziness. It can cause your memory to be impaired because of this I'm looking at long term. Sometimes it can cause headaches and fine tremors. You shake, you find yourself having small tremors, right? In other systems, I can go to the urinary and genitals. It causes urinary retention at times. It causes sometimes you find sperms in the urine. That is what we call spermatoria. Sometimes it causes malformation of the sperms themselves, then leading to impotence and leading also to decreased libido in the long run. You may not have interest in sex, you may have your sperms malformed, and finally impotence. There are a lot of arguments, but it's not true everyone. There are a lot of arguments that the people who have the Mira themselves are producing many children, but that is neither here nor there, because even all of us who are exposed to risk of diabetes don't get diabetes, isn't it? But I know you will sanction that. In maternal health, it also has a lot of problems because you realize there are also female chewers all over the place. So it reduces the birth weight of an unborn child. It can also cause stillbirth or miscarriages, because then chewing is a big problem. And it can also cause problems in breastfeeding. You can imagine you have to go to the session, and also the effects of Mira itself, changing the breast milk composition and affecting our system there. In mental illness, it also sometimes causes problems like hallucination, where you start seeing things other people can't see, hearing voices other people can't hear. So it also has a big problem. Sometimes it causes we say it causes a psychosis-like syndrome, where you become like you have gotten schizophrenia, like where your reality is altered, you are not living in a real life, and that's a problem. So there are studies showing that chewing more than 2 bundles per day is associated with mental illness. There are studies that have shown chewing more than 2 bundles, or the more you chew, the more likely you are likely to get mental illnesses from Mira. And there is also a science that talks about if you take Mira, alcohol, and cigarettes, the intoxication is additive. It combines. It becomes bigger. If you add all of them, you can add like 1 + 2 + 3 and get a bigger number in terms of your intoxication. So if you take all of them, you are likely to get addicted to all of them faster than if you don't mix them. Yeah, so that's the effect of Mira on our bodies. Have been done in East Africa, and they are few, because then the West, like I told you, in 2015 or 2014, I'm not sure which year, the UK and the Netherlands banned Mira, and the studies they were doing then stopped because they don't have users of Mira. So we have to look for the information. However, the amount that crosses the breast milk is little, but it has a lot of influence on the unborn child. It is not possible to ban one. If they ban, the only thing is it is easily accessible because it's cheaper. The Muguka is cheaper. Okay. It's easily accessible because the Miraa is a lot of money. It's like a Mercedes and a premium. So yeah, it's about that. It's about the class and the cost. But the active ingredient, so the way you can say this one causes more air pollution than this, is there a difference between air pollution of a Mercedes and a Fielder? No. Yeah.
And maybe how can you help someone who is willing to stop because he's already addicted?
Yes. Once you get addicted to Miraa, there is a characteristic withdrawal. So if you leave Miraa, you'll get some feeling of withdrawal. That we have medicine, we can treat medically, and we can work with you, we can support you. We have support groups for people who are living addiction, and we can support them through our medical and talk therapy. That is offered. In addiction, we have methods of stopping addiction. We have some method called reduction of harmful use. But the absolute method, or the sure method, is stopping, and there is medication to help you stop abruptly and deal with the foresight of withdrawal symptoms. That would be the problem. Because generally in addiction, the problem is if I leave the substance, my body requires it, because my body has already gotten used to getting a dose of the substance. But then we do this by doing a medical replacement. We do a medical replacement. Then that way, you're able to come out of it safely, because otherwise withdrawals are also deadly. And that's why you see even people who have used alcohol for a long time, they stop like this, they start getting tremors, they start getting sweating, high blood pressure. So that requires medical attention and care. And therefore, if we do that medical replacement, then we are